Hello everyone, welcome to FMT Guru. So we are going to discuss 9 FMT question asked in recent FMGE June 2022 exam. So the first question was about MTP Act. There are some changes in the body of the question, that is framing of the question, and also the options. The question number 1, opinion of two RMPs. Opinion of two RMPs required in MTP. What is MTP? Medical termination of pregnancy of gestational age between. So options are option A 12 to 20 weeks, option B 20-24 weeks, option C 12 to 24 weeks, option D 10 to 12 weeks. According to new amendment in MTP Act, the answer should be, that is 20-24 weeks. 20-24 weeks according to KSN Reddy, 35th edition, page number 313. Let's see about key changes in new MTP Amendment Act 2021. So this can be asked in upcoming exam. It's very commonly asked topic in your exam. So the key changes are, in case of contraceptive failure, it is applicable to both married and unmarried women. So both married and unmarried. So previously it was applicable only to married female. Now according to new MTP Act 2021, applicable to both unmarried and married women. Up to 12 weeks, previously 1 RMP required. Now also it is advice of 1 RMP. So for MTP, up to 12 weeks, advice of 1 RMP is sufficient. 12 to 20 weeks, all indications. Previously the answer was 2 RMP. Now it is advice of 1 RMP. You can see here, advice of 1 RMP. So up to 20 weeks, 1 RMP advice is sufficient to conduct MTP. So the update is 21 to 24 weeks. The indications are rape, incest, minors and disabled women. In those cases, advice of 2 RMP required. So this is the question asked in recent exam. More than 24 weeks, there should be approval from medical board, state level medical board, in case of substantial fetal abnormalities. What is this medical board contains? Contain gynecologist, pediatrician, radiologist and other members. So up to 21 RMP, 20-24, that is 2 RMP, more than 24 weeks, approval from state medical board. And one more update, breach in women's privacy. The punishment is imprisonment up to 1 year and also the fine. So previously there was only fine, now there is an imprisonment also. So this is question number 1 and also the explanation from the KSN Reddy. Second question was about the trace evidence. Test to differentiate between human blood and non-human blood, or animal blood and the human blood. So the question is about species identification. Species. Okay, species identification. So the answer should be, it is not Teichmann test. Teichmann test is one of the confirmatory test for blood stain. Takam is also a confirmatory test. It is also known as Hemin crystal test, both. Barbaria test, it is a test for the seminal stain. So it is not the Barbaria test. Answer should be precipitin test. Again, it is a repeat question. The question asked was about species identification. Your answer should be precipitin test. Okay. Let's discuss about blood stain. So blood stain, what are the screening tests? The screening tests, they are based on the principle of peroxidase activity. You just write here peroxidase activity. The hemoglobin has a peroxidase activity. When it combines with hydrogen peroxide, it gives rise to some colors. So all these are screening tests. They are having high sensitivity. They are not confirmatory. What are they? One is the benzidine test. Nowadays benzidine test is not used because it is carcinogenic. The color will be B for benzidine, blue color. Second, phenolphthalein test. It is also known as KM test. And the color will be pink. And it is the most common test. If they ask you in upcoming exam, upcoming FMGE exam, most common test for the blood stain, phenolphthalein test. What is the color produced? Pink color. Third, tetramethylbenzidine test. The color is again blue color. Luminol test. Luminol test asked in one of the FMGE exam. It is used for old washed blood stain. I'll just write here old washed blood stain. Okay. Then leukomelatoid green test. Again it is a screening test. The color produced is green color. And lastly, orthotolidine test. The color will be blue color. So all these are the screening tests. So the question was about confirmatory test. That is, confirmatory option was given. What are the confirmatory tests? Takayama test, Teichmann test, and one more test is spectroscopic examination, which is the best test. Teichmann test, the color will be brown rhomboid crystals. In this case, we will see brown rhomboid crystals. I'll just write here. So this can be question in upcoming exam. It is a confirmatory test. So hemoglobin combines with a reagent, it forms hemine crystals. When hemine crystals are brown color, when they are rhomboid in shape, it must be Teichmann test. You can remember brown man. Pink Yama, that is Takayama test. So in Takayama test, the color of the hemine crystal is pink color and they are feathery crystals. Pink feathery crystals. And the last one is the spectroscopic examination, which is the best test. So the question can be asked in upcoming FMG exam. The best test for the blood stain should be spectroscopic examination. For species, precipitin test is done. Okay. The most common screening test is KM test, also known as Castle-Meyer test. So the color will be pink color. So yes, question number 3. Antidote for lead poisoning. Lead poisoning and heavy metal poison, arsenic, lead, very commonly asked in exam. So we discussed many times in our classes. Heavy metal is very commonly asked. So yes, options are dimercaprol plus calcium EDTA, oral penicillamine, desferoxamine, that is NEET PG question asked, trientine. So there may be some changes in the option, but the question was asked about lead poison and the treatment. So your answer should be, the better answer according to Case and Reddy, your answer should be dimercaprol is the correct answer. So dimercaprol, basically calcium EDTA used. Whenever encephalopathy is there, you should add ball in that case. So the better answer is calcium EDTA option. So yes, let's see now what are the important MCQ that can be asked in upcoming exam. Remember, lead poisoning is also known as plumbism, is also known as saturnism. Okay, the most common source is, what is the most common source of lead poison? Your answer should be air pollution. So lead acid batteries, bullet dust, air pollution, lead chromate, that is nothing but paint dust, lead diacetate, the fatal dose is 20 gram, which is also known as sugar of lead. This can be asked in upcoming exam. Lead sulfide, least toxic, repeat question. Lead tetroxide present in sindoor and vermilion, that is also asked in exam. Tetraethyl lead, It is an anti-knocking agent used along with the petrol. Lead carbonate, the fatal dosage is 40 gram. All is taken from case and ready. That can be an upcoming exam question. So there are some 5 images are there. So what are the important MCQ? One MCQ very commonly asked is the image. You can see the topmost image on the left side. So this must be Burtonian line. This is also known as Burton's line. Okay, Burton's line. So what are the MCQs that can be asked here? So Burton line is non-specific. So it is present in 50 to 70% of the cases. It is due to lead sulfide, that is also MCQ. It is seen in copper. Not only copper, iron, mercury, silver poison also. It is first explained by Henry Burton in 1840. So Burtonian line is a non-specific line. The question was about Aldrich-Mills line. Aldrich-Mills line seen in both in thallium poison as well as in arsenic poison. So here Burtonian line can be upcoming exam question. Second important finding about the blood smear. You can see the basophilic stippling. Why there is a basophilic stippling? Because of the inhibition of the 5' nucleotidase. There is anemia and the facial pallor. The question asked about what is the earliest finding in case of lead poison. Your answer should be facial pallor. That is because of anemia or because of vasospasm. Why it occurs? It is because of inhibition of ALA dehydratase and ferrochelatase. It is the last NEET PG exam question. ALA dehydratase and ferrochelatase. So, my dear friends, and there was a question about encephalopathy. Headache encephalopathy common in children, that is commonly associated with tetraethyl lead. You can see here encephalopathy. There can be hallucination, there can be hypertension, there can be hyperesthesia, which is nothing but motor neuropathy. Motor neuropathy seen in lead poison. In arsenic poison, there will be mixed neuropathy. Again, this is asked in one of the FMGE exam. There will be uroporphyrins increased. Okay, and there is also basophilic stippling, and also there is anemia. Both are seen here. Okay, both are seen here. Both are image based question. Basophilic stippling, and also there will be hypochromic microcytic anemia that can be seen in case of lead poison. It is one of the differential diagnoses of iron deficiency anemia. Then some more image based question. Lead oleate, that can lead to abortion. It can lead to optic atrophy, arthralgia, abdominal pain and constipation. This can be asked in upcoming exam, my dear students. Most common presentation of lead poison is constipation and abdominal pain. There will be motor neuropathy that leads to lead palsy, lead bands and X-ray, that you can see here. And also lead can cause impotency. Okay, impotency, infertility, insomnia, irritability and all. So the diagnosis based on the blood levels of the lead, when it is 45 microgram per deciliter, the treatment will be chelation therapy. What is the treatment of choice? Calcium EDTA that is used, and along with a ball is also used. So ball is given when there is a encephalopathy. Other drugs are oral penicillamine, oral DMSA. So here better answer is, that is calcium EDTA along with the ball. So cause of death, encephalopathy, failure of vital functions, intercurrent infections, malnutrition. The medical legal importance of lead poison is abortion, it is occupational disease. Then souvenir bullet can lead to lead poison, that is also MCQ. It is a well-known cattle poison, it can lead to impotency and all. So lead poison very commonly asked. Please go through in and out of the lead poisoning. Yes. Leading questions are allowed in. Again, it is a very commonly asked question. Leading questions are allowed in cross-examination. We discussed many times in our classes. Leading questions are allowed in cross-examination. They are not allowed in dying declaration. Dying declaration comes under 32 Indian Evidence Act. So it is not allowed in dying declaration. It is not allowed in examination in chief. It is not allowed in re-examination. So the better answer will be cross-examination. Remember, cross-examination, there is no time limit. So answer for this question is cross-examination. It's again very commonly asked question, courtroom procedure. So leading question can be asked in case of examination in chief. So when there is a hostile witness. So let's see what are the MCQ that can be framed from recording of evidence in a court of law. It is repeated almost 3 consecutive years. NEET PG exam, FMGE exam, as well as your INI-CET exam. Let's discuss in and out of this. Recording of evidence in a court of law. The first one is the oath. What is the first step? Oath is taken. The oath comes under what IPC? 51 IPC. The oath is not required in children less than 12 years. Refusal to take oath, 178 IPC. The punishment is 6 months to 6 months imprisonment and the fine. Second is the examination in chief. By whom? Examination in chief by public prosecutor in case of criminal cases. Public prosecutor, where leading questions are not allowed. What do you mean by leading question? Yes or no type of question. But leading questions can be allowed when there is a hostile witness. What is hostile witness? U-turn witness. Leading questions are not allowed, we discussed. Cross examination. So that is usually by the defense lawyer. That is the lawyer of the opposite party. He is going to do cross examination. In cross examination, leading question, yes or no questions can be asked. There is no time limit for cross examination. Then the fourth step is the re-examination. Again, re-examination, it is by public prosecutor. It is just to clear the doubt. So the doubt during the cross examination. It is again by public prosecutor. Leading questions are not allowed. Lastly, question by the judge or by the court. So that comes under Indian Evidence Act, 165 Indian Evidence Act and section 311 CRPC. So the judge can ask any question or judge can ask question at any time. So this is asked in one of the FMGE exam. So please go through all its MCQ. Oath, examination chief, cross examination, re-examination, court questions. In the fifth question was about the sexual perversions. Again, it's a very commonly asked topic. So the tendency of derive sexual gratification from one's own pain or humiliation. So this is well known as, it is not proteurism, it is not voyeurism, it is not sadism. So masochism is the correct answer. Masochism is getting pain, that is to get sexual pleasure. So you can see here, so this is the classical case of masochism. Okay, the so masochism, that is getting pain. Sadism, it is actually giving pain to get sexual pleasure. You can see here, so this is one diagrammatic presentation of sadism. Okay, and what is voyeurism? Voyeurism is also known as what? Peeping Tom, punishable under 354C IPC. It is also MCQ asked in FMG exam. So peeping Tom. So peeping Tom, okay, peeping Tom is observing or taking image or video. So while changing dress or capturing the private act of others, that is known as voyeurism, 354C. Proteurism, it is also known as toucherism. It is also known as chikan in Japan. So it is actually, so that is rubbing the private parts against the female body part, especially in crowded places, buses, train and all. That is known as proteurism. That is nothing but the toucherism. So that all four options are very commonly asked question. So yes, question number 6. There was a history of head injury. So there was a history of head injury. On examination, hair bulbs are crushed. So hair bulbs are crushed. So they are not cut actually, they are crushed. Probable mechanical injury is. In stab wound, they are cut. Okay, in stab wound, they are actually cut. In abrasion, so it is not stab wound, it is not abrasion. In incised wound also, it is cleanly cut. So answer should be laceration is the correct answer. So laceration is the better answer for this question. So in laceration, so the hair bulbs are crushed. Let's discuss about . of laceration. So again it is very commonly asked. That's why I am going to discuss about this topic. Okay, just a minute. Types of laceration. There are 5 types of laceration. The image 1, we can see there, it is the well-known split laceration. The split laceration is also known as incise looking laceration. There are irregular margins are there. You can see bridging of the tissues. It commonly seen over the bony prominences. All these are very commonly asked. The split laceration commonly seen over the bony prominences. It is also known as incise looking laceration. In one of the FMGE exam, question was about laceration looking incised wound. Your answer should be axilla and the scrotum. They are the common sites. Second type, you can see here, there is a chop wound. Okay, there is a chop wound, also known as cut laceration. Cut laceration. Third type you can see here, it is a stretch laceration. Stretch laceration. Again you can see the irregular margins. And the fourth one, let me take different pen. So the fourth one is avulsion laceration. Avulsion laceration. There is a very important finding that is known as flaying. It is asked in one of the FMG exam. Flaying is seen in avulsion laceration. Lastly, there is one more known as tear laceration. Okay, so there are 5 types. Laceration caused by the blunt object. Laceration has irregular margins. And laceration, the hair bulb, blood vessels, they are all crushed. They are not clean cut. Question number 7. Artificial bruise is having following feature which will help you to differentiate between true bruise or from the true bruise. The question is about artificial and the true bruise. I think there are some changes in framing the question, but the question was about the artificial bruise, that is for sure. The options are typical color changes present, well defined regular margins covered with small vesicles, round in shape, negative chemical test. So the question is artificial bruise having following feature. Artificial bruise caused by the marking nut or chemical substances, usually organic irritant. Typical color changes are absent. Okay, so option A is wrong. Round in shape, that is also wrong. Negative chemical test, that is also wrong. The best answer is well defined margins, regular margins covered with small vesicles, or when there is option typical color changes are absent. That is a feature of artificial bruise. So here I will go with the 4 option. The better answer is B. Okay, let's see what are the differences between true bruise and artificial bruise. Okay, true bruise, it is nothing but the contusion. That is the true bruise. True bruise is also known as what? Contusion. Okay, so let's see how contusion looks. So contusion, what are the features? True bruise caused by the trauma. What about the artificial bruise? They are caused by the juice of calotropis, marking nut, or plumbago rosea. All these are organic irritants. Site. True bruise can be seen anywhere, but artificial bruise seen over the accessible parts. The color of the true bruise is typical color changes. So there will be red color, the red color, then the blue color, then brown color, green color and yellow color. The mnemonic we discussed in our classes RBBGY. So RBBGY, red color, blue color, brown color, green color and yellow color. These typical changes are present in true bruise, not in the artificial bruise. Okay, yes. Margins, shape, Shape is irregular in artificial bruise. They usually round in case of true bruise. Margins are diffuse, irregular, no vesicles in case of true bruise. Well defined and regular in case of artificial bruise. Redness and inflammation, they are present surrounding the skin in case of artificial bruise. In case of true bruise, they are seen only at the site. Contents, artificial bruise contain acrid serum, but the true bruise that contain extravasated blood. It is caused by the blunt object, that's why. Itching is present, as you know, all of you. Calotropis is organic irritant, it causes itching, but itching is absent in the true bruise. Vesicles, so the vesicles are commonly seen in case of artificial bruise because organic irritant, they are absent in case of true bruise. Lastly, chemical test, so they are positive for the marking nut, positive for the calotropis, plumbago rosacea, but negative in case of true bruise. So this is very commonly asked topic. Please remember RBBGY. This can be upcoming entrance examination question. Look at this. So this is the red color. Red color bruise you can see here. Margins are irregular. This is the blue color because of the deoxygenated hemoglobin. Blue color. Now what is the next color change? Brown color. You can see here brown color. Then comes is the green color. Why green color? The green color because of the biliverdin, also known as hematoidin. You can see the irregular margin again here. You can see the irregular margins. Lastly, yellow color. You can see here yellow color. The yellow color is because of what? Bilirubin. So all these classical changes are present in case of true bruise. They are absent in artificial bruise. It can be asked in upcoming exam. Next, question number 8. Person came with a history of snake bite 8 hours ago, 8 or 10 hours ago. He was already given with 10 vials of antivenom. He was given with 10 vials of antivenom at the local hospital. Following is the next step. When there are signs of neuroparalysis, whenever there is a signs of neuroparalysis like ptosis, respiratory depression, it must be Elapidae bite, it must be common cobra bite or common crate bite, but the specific snake is not specified. So definitely it is not hydrocortisone. Hydrocortisone given in case of anaphylaxis, that is caused by the anti-snake venom. Aspirin is contraindicated. That is not the answer. Check for blood coagulation profile. Blood coagulation profile is done in case of hemotoxic bite, especially viper bite, but not in case of neuroparalysis bite. Answer should be neostigmine. Remember, neostigmine along with atropine, that is given in case of cobra bite. So the better answer is B. Okay. Let's see, the question is very commonly asked. Last FMG exam, the question was about the type of snake. Let's discuss about all the 4 snakes briefly in 2 minutes. We can see 4 snakes. They are known as big 4 snakes in India. What are they? The first one is 12 mg, that is nothing but common cobra. So the first one is the common cobra. Common cobra. So what are the features of common cobra? You can see the spectacle mark. You can also see the hood. And also one more very important finding, third labial fold touches both eye and nostril. Okay, third supralabial. So this can be asked in upcoming exam. Third supralabial that touches the both eye and nostril. Eye and nostril. So common cobra is a Elapidae. It has a neurotoxic symptoms. What is the fatal dosage? 12 mg, 30 minutes to 6 hours. What is the earliest finding? Ptosis. What is the cause of death? Respiratory failure. Okay. Second you can see the viper. So this is Russell's viper. It is also known as Dubois russelli. Whenever viper is given, viper means hemotoxic. You should look for blood coagulation profile. Russell's viper is identified with the help of 3 rows of brown or black color spots over the dorsal aspect of the body. We can see the triangular head. So triangular head, constricted neck, broad belly, pointed tail, 3 rows of black or brown color spots, that is Russell's viper. The fatal dosage is 15 mg. The fatal period is 1 to 2 days. So there will be a pain at the side, there will be bleeding at the side, there will be DIC and death. And the third, you can see here, this is the one of the commonest snake in India. The fatal dosage 6 mg and 18 hours. It is the common crate. So this is the common crate. What is the scientific name of common crate? Bungarus ceruleus. Fatal dosage 6 mg. You can see here most fatal is the common crate. Again it is a neurotoxic. It comes under Elapidae where neostigmine is not given. Remember, it is a presynaptic. Cobra is a postsynaptic. Lastly, saw-scaled viper. So this is the saw-scaled viper. In saw-scaled viper, you will see all the features of viper. Triangular head, constricted neck, broad belly, pointed tail. You will see bird foot mark and also you will see white wavy line over the body. What is the fatal dosage? 8 mg, 1 to 2 days. Bird foot marks are seen. And the treatment of all these snakes, the treatment will be, that is polyvalent anti-snake venom. So what is the treatment of choice? Polyvalent anti-snake venom where test dose is not required. Neostigmine and aloatropine, they are given in case of cobra bite. Second dose is required in case of cobra bite. All these are MCQ can be asked. Elapidae means neurotoxic, Viperidae means hemotoxic, Hydropidae means they are myotoxic. All this can be asked in upcoming exam. In case of medical negligence by a doctor, next question. Continuity of events is broken by entirely a new, unexpected happening. There is some entirely unexpected happening is also known as act of God. An unrelated action intervening. What is this known as? So this is known as novus actus interveniens. The best answer is novus actus interveniens. It is also known as act of God. Unexpected, entirely new act that occurs during any procedure, especially in case of negligence. This is known as novus actus interveniens. This is very commonly asked. Why not res ipsa locator? Res ipsa locator is a fact speaks for themselves. Facts speaks for themselves. It is applicable for both civil and criminal negligence. Okay. So criminal negligence is punishable under 304A. What is the punishment? 2-year imprisonment. Okay, it is applicable to both civil, also criminal. So I just mentioned 304A because it's very commonly asked in upcoming exam. It can't be vicarious liability. Vicarious liability means let the master answer. It is the responsibility of the senior for the action of the junior. So it is also known as doctrine of captain of ship. Doctrine of captain of ship is also known as doctrine of deep pockets. Let the master answer. So that is vicarious liability. That was last year MCQ. There is one more option here. Last clear chance of doctrine. So let's discuss this last clear of chance of doctrine. But that can be asked in upcoming exam. That's why I added one more question. So 9 plus 1. The question number 10 was not asked. Only for the better understanding that was added. Let's see. So let's see. What is res ipsa locator again? You can see here there is an image. You can see in the picture there is an image. There is a history of surgery and you can see there is some instrument in the abdomen. So which is the purely negligence of the doctor, which is known as doctrine or res ipsa locator. The facts speaks for themselves. Okay. So what are the prerequisites for res ipsa locator? In the absence of negligence, the injury would not have occurred ordinarily. There is an instrument that is because of the medical negligence here. Doctor had exclusive control over the injury. Patient was not guilty of contributory negligence. All these are prerequisites for doctrine of res ipsa locator. Next, What is last clear chance of doctrine? The doctrine considers which doctor had the last opportunity to avoid the injury that caused the harm. So this can be asked in upcoming exam. So doctor was having an opportunity to avoid injury. That is known as last clear chance of doctrine. Let's discuss about this example. So doctor prescribes drug to patient, fails to inform side effects. So here doctor is negligent because he fails to inform the side effects. Patient develops rashes but fails to inform doctor. So here patient is also negligent. Okay. So negligence. Patient visit doctor on the next day. Doctor sees the rashes. He sees the rashes. Fails to take any remedial action. Patient suffers injury. So this is the classical example for last clear chance of doctrine. So this can be asked in upcoming exam. So the question number 9. So that is, so answer is novus actus interveniens. If this question is framed, if these words are there, entirely new, unexpected happening, then it is novus actus interveniens. If it is facts speaks for themselves, res ipsa loquitur. If there is a captain of ship, a senior, junior, so that is vicarious liability. So that's it about the questions asked in FMGE 2022. So wish you all the best for upcoming exam. Thank you very much.